This is Cameron Ricks here from Simrated. I want to thank you all for joining us. And I'm just going to be talking today with Claudia La Madrid regarding being a medical assistant. So thank you, Claudia, for joining us. I know the students out there are very interested in hearing about being a medical assistant. And could you just introduce yourself and tell us where you work?
Sure. Thank you. Thank you for the invite. It is a pleasure to be here. My name is Claudia La Madrid, and I work at UCI as a medical assistant. I've been a medical assistant for, honestly, about 8 years. I worked before at PAH Health before coming to UCI. I started back in 2017 after graduating from medical school, medical assistant. And it's been very interesting, to say the least.
Outstanding. So like when you were in high school, or when tell us about, like, you're in high school and then you graduate, and then how did you get into medical assisting?
So when I was in high school, like most of, kids in high school, at least at that time, I didn't know what I wanted to do. I had no idea. I went to college, took courses for everything under the umbrella. Never in my mind did I ever cross to be in the medical field. I actually started working for retail, and I was in retail for about 8 years. And then full time, had different positions. And then I had a kid, I had a daughter, and working retail, it was very different when you have family. So I started looking at my options because I wasn't spending a lot of time with them. And so I needed something different. And I started looking into it, and someone said, hey, I'm going to medical assistant program, and you should look into it. And I never wanted to do anything like that, right? So I was a little skeptical. I wasn't sure if I was going to like it or if that was for me. So I went to a orientation just to get some information. I wasn't going with the idea of, oh yeah, I'm going to do this. And so I went. It was like maybe about a year after I graduated high school that I was like trying to figure out what to do. And, after being in retail, I was tired. When I went to the orientation, it sounded good. It sounded like, okay, this is something that maybe I can do. I didn't like blood. I didn't like needles. And so for me, that was like, I can't not do this. This is like, but when I was at the orientation and I started hearing the other side of things, like, you do vitals, you roam patients, and you do this and you do that. It wasn't anything that I was like, oh, I can't do that. That's not a problem. It's not like I'm going to be cutting into patients or anything like that, right? So took me a while to finally decide to do it. And so I went in and I went ahead and, I started doing that. And that's how I got into the medical field. It was an 18-month program. I went to an adult school. I didn't want to do any training school. Because I wanted to make sure that I did it with enough time, and on my time. Being that I had a little kid, I couldn't be away from home, all day. So I had to do it part-time. And so it was only a few days, and mainly it was like at night, like after 6 o'clock. And I came home, would do my homework and all that stuff when the baby was asleep. And so when I graduated, we did an externship. And the school helped us try to get jobs, but I was very lucky that where I did my externship, they liked my work ethics, and they hired me 2 months after I finished my externship. And once I had gotten my certification as a medical assistant.
So how did you find your school?
So I would get flyers or like a little booklet in the mail. And so I was going through it, and I found one. And the adult school that I went to, that's where I found that it actually came in the mail. And so when I saw it, I was like, let me go look. I mean, they had different career paths. And at that time, being a single mom, I needed to make sure that my income wasn't going to change, that at least it stayed within the same range. And so I was looking at the potential pay, and it looked like, that was the most close to what I was making at the time. And so I called the school and I asked them, and they said, oh yeah, we're gonna have an orientation on this date. You're more than welcome to come. And so that's how I ended up finding the school. And it wasn't that far from my house. It was only like a 10, 15-minute drive. And it was very eye-opening.
That's fantastic. And then within medical assisting, it seems like there's, and I'm not an expert, but it seems like there's like a large variance. You can become a clinical medical assistant or an administrative medical assistant. Some people are certified, some people are not certified, some people learn on the job. Can you talk a little bit about that?
Sure. So I am a certified medical assistant. When I graduated the program, my teacher gave us the option as to whether we wanted to get certified or not. And you do not have to get certified if you don't want to. It's just an additional test that you have to do right after graduating and completing the program. For me, it was just a no-brainer at that time, only because when you do get your certification, at least for me, you are able to go anywhere within the States. And so at that time, I was planning on moving to Maryland, which never happened. But, in my mind, I wanted to move, and I wanted to make sure that when I did it, that I was going to be able to still find a job out there. And so that was my main reason of why I wanted to get certified. It wasn't that hard to do. There is different positions that you can do. Like for me, I have worked different specialties. Like I've done family practice, I've done pediatrics. Currently, I am working under a multi-specialty facility. And so we do have about 20 to 30 different doctors that come, different specialists that, rotate through the clinic. And so as far as my position is like, I do rotate through all of them, through all the specialists. I do a lot of patient care, help the providers with procedures like biopsies. And, it just depends on what the specialty that I'm working on. But as a certified medical assistant, I am able to do a little bit more than if I wasn't certified.
Gotcha. So it sounds like your job really on a day-to-day basis is pretty variable. There's a lot of different things you might be doing. Can you just give us kind of a day in the life? And I know you may just have to be very general because it sounds like there's a lot, it just depends upon the day. But just generally, what does your day look like?
Sure. So my day starts, quick. So we go in, and again, it just depends on the day. Normally I work with dermatology, which is the one that I do the most. And so we start very early in the day. A lot of times, and it depends on the provider, a lot of times we start with surgical procedures, like for example, excisions. And when we do that, I start my day by setting up sterile procedure trays so that the doctor is ready by the time the patient comes in, everything is all set and ready to go for the procedure. We get lidocaine ready for the doctor. We fill out our liquid nitrogen so that they can have it ready for freezing if they need to during the procedure, and then assist the provider during that. Throughout the day, we just do rooming patients, taking vitals, getting them undressed if we need to for any skin checks. Then we would do, throughout the day, sometimes the provider will also ask for us to set up trays for biopsies. And it's a little bit less set up than for an excision. And, we just set up the trays, give them lidocaine, take vitals on the patient, answer any questions that they have, schedule follow-up appointments, answer messages, phone calls, assist any patients that walk in, because we do get a lot. We do get a lot of patients that, just walk in because they're closer to the clinic. And so they feel that, I just better come in and ask you a question directly. And I, throughout, I'm very approachable with my patients. And so I always tell them, hey, if you need anything, I'm here for you. I'm here for you, to help you, to guide you, to answer any questions that you have. And so they take advantage of that. So when they know I'm in the clinic, they prefer to come in and, see me and talk to me face to face, as opposed to, oh, I'm just going to call her and leave her a message.
That's really fantastic. I mean, I think that, the medical assistants are a critical part of any office because you are the front line, you are interacting with the patient. And like you said, you are oftentimes the one who's gathering information. And then as a doctor or the nurse practitioners move from room to room, they move very quickly. And so you're often giving them the information that they need to do their job. So I appreciate that. That's fantastic. What's the favorite, what would you say your favorite part of your job is and your least favorite part?
My favorite part, it's teaching the patient. When we do procedures, we do have to let them know what it is that they need to look out for, as far as, any infections that they might, because there's always a risk, right? But anytime you do any procedure, you will always have that risk, and not necessarily mean that it will happen, but we have to make sure that our patients understand, they know what it is that they need to look out for, so that they can give us a call and say, hey, look, this is what I'm feeling, this is what I'm seeing, what can I do? And so for me, I feel that teaching them on the things that they need to look out for, it's very important. I right now just finished my nursing school, and so teaching during my program for LVN, teaching was the biggest thing for us. And so I've learned that, a lot of times our patients might leave the facility not knowing, or, with a doubt. And so for me, that's the biggest thing. I like to make sure that my patients leave my office, like knowing that, every question was answered, and that they have a knowledge of what they need to do if something were to go wrong with their procedure, which, so far, thank God, we haven't had any major issues.
And then your least favorite part?
Oh, I don't know. I think it's just, it would probably be, when you have those things that you are not able to solve for the patient. I just don't feel like, if I can't give them answers, I feel like I didn't do my job. And so when I don't have the answer for them, it's like, it might take a while, but at the end of the day, it's like, you know what, I have to hand it off to somebody else to see if they can help me, because I wasn't able to. And I just don't like that feeling. I feel like as a medical assistant slash LVN, I feel like I should be able to give them a lot of the question. I mean, I'm sorry, a lot of the answers within my, within my capability.
Yep. Yeah, I mean, that's always difficult. That's a very difficult part of medicine when you don't have the exact answer, but a patient, because you want to help the patient. So it can be very challenging. But I wanted to say congratulations on moving on to your LVN.
Thank you.
Can you just kind of touch upon that? Like, do you think medical assisting is a good intro and a good stepping stone to advancing in a healthcare career?
Definitely. For me, it was. Like I said, I've been a medical assistant for so long, and I've always, when I started, I was like, oh, this might not be for me. This might not be for me. But as the time went by, it's like, you know what? I found that passion. I finally found that one thing that I felt like, hey, I'm doing good. I'm like, it excites me. It's just, I felt like I needed to keep on going. I was like, you know what? I can do so much more at a different level. Because as a medical assistant, you're limited as to what you can do. And then, if you go to the next level up, then of course you have a little bit more of things that you can do. And so I felt like, you know what, I think I can do this. and talking to a lot of my coworkers that are LVN, and I see what they were doing, and I'm like, I want to do that. Like, that's cool. That's interesting. And so I felt like it was the right path for me, that, I could do it. And so I went, and it was very hard because when I started, it was right before COVID hit. And so for me, going through a pandemic, trying to finish my nursing school is very difficult. But, I finished it, I did it, and I feel that that was the right decision. It was the best decision I could have made.
No, that's fantastic, and I really applaud you for moving forward, and I hope that you're able to stay at UC Irvine and as an LVN.
I hope so too. I mean, that's the idea. That's the plan. I want to stay. I feel like I found my home, and I've already talked to my boss. And I hope that I do stay within UCI. That would be the best.
Well, we
I am.
go ahead.
I'm sorry.
No, I was to say we hope so too.
Yeah, I am planning on some down the road getting my RN, but I want to take a little break because it was very, very intense going through the pandemic and trying to finish school. So I neglected my family a lot, but it's okay. They know the sacrifice is worth it at the end.
Yeah, it's a long road. I mean, but I agree with you. It is. It's worth it in the end that you're able to, give back more to your family and do more in your career. So I'm really excited for you. That's fantastic. Well, we're getting kind of near the end here, and I really appreciate your time. But I wanted to kind of close with, by asking you, if someone is watching this video and they're in high school and they're thinking, you know what, I want to be a medical assistant. Do you have any recommendations to them or anything to tell them?
Yeah, I mean, I would highly recommend, look into the adult schools. A lot of times we don't feel that because, the term adult school, it's not like teenagers or, kids, right? But I had a lot, when I was going through it, there was a lot of teenagers, a lot of kids straight out of high school trying to do something different. And some of them, had tried a trade school. And to be honest, the difference is just minimal. I felt that going through the adult school gave me the liberty to, if I still wanted to, I could still work during the day. I can still have that time because they allowed us to do, they had the nighttime program. And so I feel that as, recent high school graduate, if you want to work, which I know because I have two in house, that they're like, oh, I want to work. I was like, okay, but you still need to do something with your life. And so I feel like adult schools give us the opportunity to do that. Do research and find out about the school. Make sure that it is the right school, and that the real readings or reviews, that the school has good reviews. Because I have heard stories about schools that, they're not the best, but that's going to be everywhere.
Yeah, I agree. Absolutely. I think do your research I think that's very wise and good advice. All right. Well, Claudia, thank you so much for your time today. It was very interesting, and I know that students will love to hear about medical assisting. We'll put a link at the end here to is there a society, like the Medical Assisting Society?
I am certified through NHA, and it's Associate Health something. I can't remember.
That's okay.
I'm
We'll
sorry.
look it up. Yeah.
Yeah, it's NHA now, and that's where I'm certified through. And I went to ABC Adult School in Cerritos. They have two different campuses, and so that's where I went to do my medical assistant.